There are a whole bunch of different ways that we can develop pain and injury in our shoulders. Now, one of the general mechanisms behind a lot of these problems is something called impingement. Now, to explain impingement in the simplest terms possible, our shoulder is made up of our shoulder blade, our scapula that sits on the back of our rib cage, and then we have our humeral head and our humerus, our upper arm that feed into that shoulder blade, create a ball and socket joint. Now, what can happen is we'll develop imbalances in which our shoulder blade goes from this nice neutral position into a forward position. What that looks like practically is when someone has rounded shoulders. Now, in that forward position of the scapula, what we get is these two bony processes, these outputs, will start to come into contact with the humeral head, which as we go through a range of motion is going to wear down those joint surfaces. But what also happens is there's a whole bunch of tissue that's inside of that ball and socket joint that also gets ground down in between those 2 points of contact. So what we're going to talk about first is some of the musculature that pulls that scap into a bad position, into that impinged position, mobilizing that tissue so that we can regain a neutral scapular position. Now, where we're going to start with this first sequence is addressing our pectoral and our deltoid to start to regain that shoulder position, open that back up so that we're not getting impinged, we're not getting pain, we're not getting injury. The best tool we have to address that overactive tissue that's pulling at the front of that scapula is our lacrosse ball. So we're going to use our lacrosse ball for some targeted pressure release, and the area we're going to be in is going to be anywhere from right in the middle of my pec, okay, so right where our sternum is, all the way out to our deltoid. Okay, through that tissue, you're going to find a whole bunch of trigger points, and they're all contributing to that bad hunch forward shoulder position. So the way we're going to do this is we're going to use a wall. I have my lacrosse ball on the wall. I'm going to start right in the middle of the chest. Then I'm going to slowly roll out towards that deltoid, looking for sensitive spots. So in this case, starting out the middle of my chest, slowly working through, and bang, already I have a trigger point. Let's make sure we're relaxed, we're breathing, and from there we'll use our contract relax. For contract relaxing in this situation, whether it's our deltoid or our pec, the way we're going to do it is we're going to press our hand into the wall, okay, and that's going to get the front of our shoulder to activate. We'll hold that for 5 seconds, 5, 4, 3, 2, 1, and then after the fact we will breathe, let that pressure dig into that tissue, 30 seconds. Then we'll go back into our contract, 5 seconds of pushing into the wall, 5, 4, 3, 2, 1, relax, 30 seconds. After 3 of those cycles, we can either go look for some more trigger points, once again, anywhere in the pec to our deltoid, and we can even go a little bit lower in our pec as well, or we can stay on that same spot that will prove to be sensitive right at the beginning. Let's get 3 to 5 minutes of that, okay? Breathing, relax, addressing where we're nice and sensitive, and then from there we can stretch out that tissue to create further looseness and restore our scapula into a better position, hopefully stop some of that shoulder pain. Our stretch isn't going to involve any tools, just a nice sturdy wall. So the position we'll be in is I want my fingers facing towards the ceiling, okay? I want my elbow facing down towards the ground, so rotating your elbow down towards the ground. And then finally, we're going to step forward, and with our arm anchored there, we're simply going to open our chest away from that. Should feel a nice big stretch on the front of this pec, maybe even up into the deltoid. And from there, we're going to find our end range. So to find our end range, all we're going to do is see how far we can rotate away from that shoulder with our chest. So this is about it for me. Now that I've found my end range, let's relax, take some breaths. This isn't exactly the most comfortable situation, so let's make sure our nervous system isn't too ramped up. And then once we have that relaxation, we'll use our contract relaxes. In this situation, what our contract is going to look like is pushing forward through our hand. So even though our hand is going to stay in the same place, I am creating tension like I am pushing forward, okay? End range. And we're just going to hold that static contraction for 5 seconds. So I'm pushing forward, feel a little contraction on my pec, 5, 4, 3, 2, 1. And then after that contraction, we'll relax and see if we can open our chest away from that arm anymore, get any extra range of motion out of that shoulder. After 30 seconds, we'll contract again, push our hand forward, 5, 4, 3, 2, 1, and then relax, see if we have any more range. Minimum 3 contract relax cycles. If you got more time, spend more time. 3 to 5 minutes is always kind of what we're striving for. And then as far as the sequence, be consistent with it. Give it 2 weeks, 15 minutes a day. See how it helps your shoulder pain. Give us that feedback. And if you have any questions, please reach out. I want to help.